Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With us today is Dr. Matt Binnicker, an esteemed microbiologist, a virologist, and a frequent guest on this podcast. Dr. Binnicker is the previous director of the Clinical Virology Laboratory at Mayo Clinic in Rochester, Minnesota, and he serves as the Chief Scientific Officer for Mayo Collaborative Services. Welcome back, Matt. It's great to have you on our podcast.
Hey, Dr. Pritt, thanks for having me back.
Yeah, we have a number of things to talk about, and I always know when I have Dr. Binnicker on the call, it's probably we're going to be talking about respiratory viruses, other circulating viruses, and today is no exception. So
yeah, always fun things to talk about in the world of viral infections.
Well, let's start with one that's a little atypical, but it's been in the news recently and kind of interesting. It's this virus of rabbits called the Shope papilloma virus. And there's been people noting these rabbits with these dark tentacle-like structures sprouting from their heads and their faces. What's happening with these poor rabbits, and where are we seeing this?
Yeah, this has been making the news recently. It started when residents in Fort Collins, Colorado, started to see rabbits in their backyards while they were out for hikes. And these rabbits appeared to have these black horns or growths that were coming from their head and around their mouths. And I'm sure you can imagine this was potentially disturbing to those who were seeing this. It got to the point where some of these residents in the Colorado area were referring to these poor rabbits as zombie rabbits because of their appearance. Now, fortunately, it's not due to a zombie apocalypse. It's actually due to a viral infection that's occurring in these rabbits. And as you mentioned, the virus is called Shope papillomavirus, or sometimes referred to as cottontail rabbit papillomavirus. And these rabbits acquire the infection by being bitten by an arthropod, like a mosquito or tick that's carrying this virus. And it's not just in Colorado. It was actually first discovered in the 1930s. And there were hunters out in Iowa, and they started to see these rabbits with these black growths coming off of their head. So they, notified some public officials about this. And then a researcher named Richard Shope went on to characterize that this was actually due to a virus in the papillomavirus family.
Well, this is fascinating, and I could have sworn I saw some rabbits in Minnesota that have these dark growths on them. So I guess if this has been described in the Midwest, then it's not out of the realm of possibility that we have them locally.
Yeah, very possible. And as I mentioned, it was first recognized here in the Midwest. So I think it's entirely possible for residents of Iowa, Minnesota, Wisconsin to be seeing rabbits with these. So don't be surprised if you see them in the future.
Well, thanks, Dr. Binnicker. Now, I have to say I have a love-hate relationship with these rabbits because they eat all the plants in my garden, but I do feel kind of bad for them. But I know the question that all of our listeners probably has is, what does this mean for humans? Are these infected rabbits a threat to humans?
Despite their disturbing appearance, the rabbits are not a threat to humans.
Okay.
The virus is actually what we call species specific. So it can infect rabbits, but it can't cross over and infect humans. And then some might also wonder, well, what about my pets, like my dog or my cat? And fortunately, the virus can't infect dogs or cats either. But if one has a pet rabbit, it is possible that the pet rabbit could become infected. So it's very important if you have a pet rabbit to keep it away from any wild animal, especially wild rabbits.
And do they get it from the wild rabbits or through an arthropod bite?
You would get it from an arthropod bite, but you just want to make sure that they're not interacting with wild animals in the event that there was a tick or a mosquito in the area who could take a blood meal off of an infected wild animal, like a wild rabbit, and then infect your pet rabbit.
That makes sense. Well, so we hear the word papillomavirus in this name, and that probably makes a lot of us think of human papillomavirus, which of course causes cervical cancer as well as benign warts and growths and other conditions. So is there a relationship between the Shope virus and human papillomavirus?
Yes, there is. Actually, the viruses are very similar from a structural and genetic perspective. They're both DNA viruses, and they share a high level of genetic homology or similarity. And as you mentioned, human papillomaviruses can cause a range of diseases from benign skin or genital warts, or in some cases, can cause cancers like cervical cancer. And a little known fact is that the discovery of the Shope papillomavirus or cottontail rabbit papillomavirus actually led to an animal model, the virus with rabbits, that allowed researchers to study papillomaviruses, including human papillomavirus. And that's contributed significantly to our understanding of HPV, its association with cancer. And then it's played a really important role in researchers who are developing vaccines against HPV. So while the virus causes these disturbing growths in rabbits and may actually cause some to be a bit afraid of seeing them, it's important to realize that they've played an important role in human health.
Wow, that's fascinating. So I have to ask, despite the damage they do to my hostas, I feel kind of bad for them. Does it really hurt the rabbits themselves, or is it more of a nuisance?
You know, in most of the cases, the rabbits can live with those growths. If they
Okay.
get to be big enough, it can impede their vision. And in some cases, if there's a lot of growths around their mouth, it may prevent them from eating. So that can cause some problems. And then in rare circumstances, just like in humans, the Shope papillomavirus can progress to cause more of a malignancy type of situation. But in the majority of the situations, the rabbits can live with these growths.
Okay, phew, I feel better now. Well, that was fascinating. Let's talk about some more viruses and let's switch gears to chikungunya virus. This is one that is impacting humans, mosquito-borne. So again, an arthropod-borne virus, and it can be really debilitating for infected people. I remember hearing stories about how it feels like you have severe arthritis. Even in a young person, you could be bedridden. And the concern is that it's spreading to other parts of the world, including China, France, and Italy. It's endemic in Mexico. So, can you tell us a little bit about chikungunya virus and how dangerous it is?
Yeah, absolutely. Chikungunya, it's a viral infection. As you mentioned, it's spread through the bite of an infected mosquito, and it's been causing large outbreaks in several countries around the world. It's most common in tropical and subtropical regions, Africa, Asia, Central South America, islands in the Pacific. Um, and when people are infected with chikungunya virus, they can be really ill. They can have a very high fever. They can develop severe joint swelling and joint pain. They can develop a rash. So it is not an infection that you want to have to go through. The patients who are infected with chikungunya virus have a really high amount of the virus in their bloodstream during the first few days after developing symptoms. And so mosquitoes can come along, take a blood meal from that individual, and then go on to infect other people. So that's why mosquito control and preventing mosquito bites becomes really important.
Well, that's good to know. Who is most at risk of infection?
So anyone who lives in an endemic area for chikungunya, so an area where the mosquito vector is present, and I know you love your mosquitoes, Dr.
Oh,
Pritt. So
yeah.
it's I believe it's the Aedes aegypti and Aedes albopictus mosquitoes that are the primary vectors for chikungunya virus. So wherever those mosquitoes are present, you can be at risk for acquiring the infection. The good news is that chikungunya isn't spread through like the respiratory route. So if you're coughing or sneezing, you're not going to spread that virus. But as I mentioned, it can be present at really high levels in the blood. So there are a few other populations of people who can be at risk. First, those receiving blood transfusions. So if you happened to receive a blood transfusion that was contaminated with chikungunya virus, you can get it that way. And then laboratory professionals and phlebotomists have to be on the lookout for this as well. If you're working with a sample that's got a really high level of chikungunya virus, or you're drawing blood from a patient with chikungunya, you have to take some extra precautions, wear eye protection, wear gloves, and most importantly, avoid needle sticks.
Yeah, those are good points, Dr. Binnicker. And I know I said it's endemic in Mexico. It's my understanding that for the most part, we see this in travelers. And I think in the past, there's been some endemic areas in the US, but do you consider that a concern at this time?
You're absolutely right. Most of the cases that we diagnose and see here in the US are travel associated. But with climate change and it getting warmer in the southern regions of the country, and with the mosquito vector beginning to become more prevalent in different parts of the world, I wouldn't be surprised if in the near future we start to see endemic transmission of chikungunya like we are with other mosquito-borne viruses like dengue virus.
Well, that's a really good point because it's the same mosquito too that transmits dengue as well as Zika virus, yellow fever virus.
Right.
Oh, yeah, something to keep in mind. Well, with high levels in the blood, that could be a route for detecting it. So, can you tell us a little bit about the various tests we have for chikungunya virus infection?
Yeah, you mentioned laboratory tests and diagnosis. That's really important because the disease can resemble other infections like malaria or dengue fever that travelers might get on their same trip. So it's why lab testing is a critical component. There's a couple different approaches we can take. First, we can use serology or antibody tests, see if the person's developed an immune response, made IgM and IgG antibodies against the infection. The limitations to that approach, it can take 7, 10, 14 days for the antibodies to develop. So that may limit serology as an acute diagnostic test. Fortunately, we do have some PCR tests, and those actually look for the viral RNA in the patient's serum or blood, and that's a better acute test. So during the first few days of symptoms, your PCR test is going to be the more preferred option.
That makes sense. So, it's important to know the onset of symptoms to determine what the best test would be. And that's
Exactly.
true for a lot of our vector-borne diseases. And thankfully, we offer a test at Mayo Clinic, and I believe other labs, public health labs, may offer that as well. Well,
Exactly.
let's now move on to something that maybe is a little closer to home, and that is things we worry about with our kids going back to school and some of the infections now that they may be exposed to. So it's probably a good time to remind everyone about the importance of keeping children up to date with their vaccinations, teaching personal hygiene practices, watching out for symptoms of illness. Can you share some of the common viral infections we see in the fall, especially among school-age children?
Yeah, our schools are a great place for learning, but they also serve as great incubators
Yeah.
for infectious diseases. And there are quite a few viral infections that increase as our kids go back to school, especially during the fall and winter months. One that I'd start out by mentioning is enterovirus because it tends to peak in the late summer, early fall, like pretty much the months, August, September that we're experiencing right now. Enteroviruses most often cause kind of a common cold, but they can cause aseptic meningitis. So that's something to keep in mind. We also, of course, see a rise in respiratory infections, especially as we head into the fall and winter months. Those can include respiratory syncytial virus, of course, influenza, COVID-19. Um, Viruses causing gastrointestinal diseases, diarrhea, vomiting, also very prevalent during the school year. Those can include viruses like norovirus, adenoviruses. And, we talk about vaccination. One of the best things that students can do to stay healthy is to wash their hands, especially before they eat, or they touch their eyes, nose, or mouth. But back to vaccination. Vaccination is available for common infections like influenza and COVID-19. So I really encourage all school-age children and their parents to remember to keep up with your vaccinations. And then one last point I'd like to make on the vaccine front is we've seen a rise in vaccine preventable diseases over the last several years. So diseases like pertussis or whooping cough, disease like measles infection are on the rise. We've seen outbreaks in schools, and that's in large part due to declining vaccination rates, which opens up the window or the door for these infections to get into a community, especially in schools, and then take off and cause outbreaks. Now, those diseases that I mentioned, whooping cough or pertussis and measles, those can be quite severe. So it's essential for children and even young adults and adults, if they haven't been vaccinated, to talk to their physician about getting updates to their vaccines.
I'm really glad you mentioned that, Dr. Binnicker. I've been hearing about some of the measles outbreaks in our unvaccinated populations, and there have been fatalities. Children have died with measles.
Yes.
Whooping cough can be fatal, diphtheria can be fatal, and I would hate to see some of these terrible preventable diseases coming back. And of course, you mentioned enterovirus, and that reminds me that poliovirus is an enterovirus, and
Right.
hate to see people on iron lungs have that come back as a problem.
Definitely not something we want to see.
So we know that not all illnesses require lab testing. Can you tell us a little bit about when it would be appropriate for physicians to order tests for their patients in this setting of going back to school, especially for those that are presenting with some of these common viral syndromes?
Yeah, absolutely. Lab testing obviously is important in certain circumstances, but isn't always needed. And so I think physicians often look at one, the patient, and two, the severity of their symptoms to determine whether testing is required. So if a physician's seeing a young patient who's otherwise healthy and they're experiencing mild symptoms like a runny nose and an occasional cough, they may decide that no testing is needed. Let's watch this for a week and see if things resolve. But if the symptoms are severe or become severe, and they may include things like a high fever, development of lower respiratory symptoms like a really productive cough or a dry hacking cough, or if the patient has an underlying health condition, let's say they're asthmatic or they're a cancer patient, then it's probably a good idea to get testing so you know what you're dealing with, determine whether treatment is available. Also, like to point out that for common viral infections like influenza and COVID-19, there are treatments available and they're different. So even though a patient may present with symptoms that could be COVID or flu, the only way for us to really determine what treatment is best is to do a test, find out what they have so that you can tailor their antiviral therapy.
Great points. And there are a number of these tests that are commercially available, and we offer some. So they're pretty widely available these days. It's definitely different than in the beginning of the COVID outbreak when we
Yeah.
didn't have those tests.
Yeah,
Well,
you're right. Labs commonly test for influenza, RSV, and COVID all in the same test.
mhm.
And all three of those viruses can cause overlapping symptoms. So it's really easy to go in and get a nasal or nasopharyngeal swab and have that one sample be tested for RSV, COVID, and influenza.
Great points. Well, this has been a fascinating discussion. Let's wrap up our conversation by talking about how this is important to us that are laboratorians, and as we navigate both emerging viruses as well as the seasonal patterns of familiar ones. Can you tell us a little bit about, in your view, what role the laboratory plays with these viruses in helping our patients who may have them?
Well, our laboratorians are an essential part of the healthcare team. They're really the foundation of the care that patients receive in many circumstances. Our labs provide needed diagnostic information that helps physicians diagnose their patients and determine what types of treatments they should be on. But labs also serve as that early warning system to outbreaks and emerging infections. So I know our lab at Mayo Clinic is tracking the positivity rates for many of these infections. And when we start to see the rate increasing, we notify our physicians. Influenza is now in our community. RSV is rising in the population. So the physicians then know what pathogens are in their community. That helps them with diagnostics, that helps them with treatment. So we're really providing the information to our healthcare teams to best care for their patients. And then when there's larger outbreaks or pandemics, laboratories are developing new methods to track these and identify the causes of these infections. So from routine to identifying brand new pathogens, again, I really feel like the lab and the lab professionals are a central piece to that healthcare team.
I really like how you said we are an essential component of the healthcare team. We're part of the patient care clinical team. And the services we provide aren't just simply diagnostic, like you said, serving as an early warning sign for detection of novel or emerging pathogens, providing local epidemiologic data on the cases we're seeing. And it really does serve as the foundation for clinical medicine. So thank you for bringing up all these points and the fascinating discussion about viruses from rabbits, exotic to local viruses. It's been a great discussion.
Yeah, well, thanks again for having me on. It's always fun.
I'm sure we'll have you back again. Thank you again, Dr. Binnicker.
Thank you.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.